Dr. Dani McVety Leinen founded Lap of Love Veterinary Hospice just 3 months after graduation from the University of Florida College of Veterinary Medicine. Their team is dedicated to making the end-of-life experience for pets, and the people that love them, as dignified and peaceful as possible.
Hi there, I'm Dr. Dani McVety. I am founder and CEO of Lap of Love Veterinary Hospice. Lap of Love provides end-of-life care to pets and helping the people that love them nationwide. So I'm very honored today to represent the veterinary profession and to talk to you guys about the art of euthanasia. And this talk is really about helping you understand what euthanasia is, the types of people, the types of doctors that help out, and really going through the entire process to help you feel comfortable with really just the actual process of euthanasia. It's a really difficult conversation to have, obviously, with families, and it's important that we help you frame that conversation in a way that's supportive of you. And to be honest, one of the major, things that I want you guys to take out of this conversation is the steps that you can take in order to feel as least guilty as possible after the actual process of euthanasia occurs. There's always going to be some type of guilt. I know I've been through it myself as well, but hopefully this conversation is going to help you feel like you know what to do next, and that you can make the right decision moving forward so that you feel comfortable with what happened. It's never going to be perfect. Losing a pet is awful and terrible, but hopefully you can feel as comfortable as possible. I'm going to start with this, which is really what everybody says when they hear about what I do, or, particularly when I'm on call and I walk into a home and somebody opens the door and they see me and they just start crying. And, they say something like, how do you do this? This must be the worst part of your day. You must have a terrible job, or things like that. But let me tell you, this is an honor. Okay. It's an honor to help you through this entire process. And doctors that type of work, for a while I thought I was the only weird one out there, but I'm not. There's many of us that feel this way. We love doing this. We love helping you through this process, and it is truly an honor to help you through this. So I hope you see it that way, and particularly from our conversations, I hope you feel like it is something that helps you. So the first thing I wanted to do is help you understand that when we talk about end of life care, what we're talking about is shifting from a quality of life, right? Which is what veterinary medicine is all about, is providing a quality of life to the families and to the pets that we see, shifting to a quality of death. And by quality of death, I mean that you have two options, okay? You can either try to, eke out every last moment that you possibly can with your pet, but what's happening is that you may risk an emergency situation if you waited too long. And rushing to the emergency room, and that's why I started this company, is so that there's a better way. And that is what I mean when I say a quality of death. So it is actually possible to have an experience with your pet that is this compassionate, loving, calm experience in the home, if you want it to be, or on the beach at sunset, surrounded by family and by saying prayers together. And that's possible if we make the decision at a particular time that is supportive of the disease process that your pet is going through. The way that I explain it to people, because everyone always assumes that there's this like perfect moment that you want to say goodbye to your pet, right? There's one moment in time, but really there's a subjective period of time in which euthanasia is a good decision. It may not be your only decision, but it is a good decision. And before this period of time, I'm going to refuse to euthanize because there's a quality of life that exists. And of course, I don't want to euthanize a healthy animal. Now that's a subjective conversation, okay? But after which there's suffering, sustained suffering that's going on. And this is the euthanasia that happens, in the emergency room, right, at 2:00 in the morning, and your pet is crashing, and nobody wants that on purpose. Nobody wants to have that experience. But there's this greater subjective period of time in which euthanasia is a good decision, but it may not be your only decision. There are some families that like to make the decision at the beginning of this, of this time frame, and maybe they want to make it at the, at the beginning of a bad diagnosis. And then there's some families that like to push it to the very, very end. I will tell you something that's very, very interesting that I would not have known before I started doing this work, which is that people that are going through it for the first time tend to make the decision a little bit too late. And that's not necessarily my opinion. That's just what they tell me when it's all said and done. A lot of the times people in the age range of 20s or 30s tend to wait a little bit longer and longer, because many of times this is the first time that they're going through it. and they want to eke out every last moment. But fascinatingly enough, the more times families go through the experience of loss, the earlier and earlier they make the decision, simply because that waiting game is so stressful for people. It's so stressful to watch your pet go through those things, the pain and the waking up and wondering if he's still alive, and having to leave to go to the grocery store and coming home and did something happen, did he fall and hurt himself? So there's a lot of things that can stress people out. I'll give you an example. There was this one family that I helped, and they had a golden retriever that had osteosarcoma, which is bone cancer. And that's a relatively common thing that golden retrievers will face. And they called me when they got the diagnosis, and we walked with them for 6 months. They did hospice care for 6 months, and they did everything. They did everything they were supposed to do. They were a wonderful, wonderful family, and they really pushed the boundaries of knowing when that right time to euthanize was going to be. But then they knew, so they had the line in the sand drawn, and they knew that when he couldn't make it to the mailbox anymore on their walk, that they were going to make that decision. And the day came, and we euthanized. Within about 2 years, their other dog, their other golden retriever, was diagnosed with bone cancer again, or their second dog. And they called me on the way home from the doctor when they received that diagnosis. They called me, and they said, "Doc, we don't want to wait 6 months anymore. We want to make the decision soon." And so within a couple of days, I went and euthanized her. And you can see that they knew that they could have another 6 months in theory, right? They could have another 6 months with her, but it was so stressful, and it was extremely traumatic for them to wait that long. So they made the decision sooner. It's just an example. And the fact remains that everybody thinks there's this one moment in time that's perfect, but there's not this one moment in time. There's a subjective period of time. Now, I will tell you that the most important thing when determining when you want to make that decision, whether or not it's going to be sooner or whether or not it's going to be a little bit later, the most important thing when making that decision is to understand what the disease process of your pet is. There are some disease processes where you can wait until the very last moment, right? Something like degenerative myelopathy, the German Shepherds get a lot, or arthritis, the simplest one, or chronic renal failure, like our cats get so often. There's a lot of conditions that we can wait till the very, very end. But there are a few conditions that I really recommend making the decision sooner and sooner and sooner. And one of those conditions is congestive heart failure. Or another one would be some type of brain cancer, or another one would be some type of lung cancer, or particularly even bladder cancer as well. There are some organs like the heart and the brain and the lungs that will work until the second they don't, meaning it's a cliff and it goes downhill quickly. So if somebody has an elderly pet, that has congestive heart failure, I don't want them to wait until the very last moment. And I explain to them, look, if you wait too long, you will be rushing to the emergency room at 2 o'clock in the morning, which is again why I started this company, so that you don't have to do that. So make sure that you talk to your veterinarian about the disease process your pet has, and ask them what type of death process you're looking at. If it's something like hemangiosarcoma, which is a blood-related cancer that dogs get very frequently, again, you're looking at a cliff scenario where they're going to be fine until the second they aren't, and you're going to come home and potentially find them laying on their side. And if they haven't passed away yet, then it could be a long, difficult hours until they actually die, and those hours aren't going to be very nice. They're going to be very, very difficult and sufferable hours. So it's that experience versus a quality of death experience, which again is possible with euthanasia. Euthanasia allows us to have this beautiful, loving experience that, although it might, it might still feel like it's too soon, at least you're having this experience that is, again, surrounded by love, surrounded with family, surrounded with, just a beautiful, beautiful experience for families. Here's just a couple little things that people tell us all the time. A lot of times families come to us because they want an in-home experience. And typically they will say one of these three things. Sometimes they'll say, I'm worried my vet will judge me and to try to talk me into more treatment, which I understand. And as veterinarians, it is our job to give you the options. But one of my favorites, quotes from Jurassic Park is, just because you can doesn't mean that you should. And just because we can do all these expensive, continuous, long drawn out diagnoses and procedures doesn't mean that that's necessarily the best for the quality of life or quality of death of your pet. So I understand that. And that's why saying the word hospice to your veterinarian will help them shape what you want. It is frustrating when you walk into your veterinary clinic with a 15-year-old dog that has advanced arthritis and they want to do $800 worth of workup, blood work and x-rays and that type of thing before they give you just simply a prescription for pain. You need to tell them and, say like, I'm in a hospice situation, doc. I just want to do the things that is best for my pet that's going to make a difference right now. We know that he has arthritis. We don't need to run an x-ray to find that out. So again, I want to enable you guys to feel like you can say those right things to your veterinarian so that they can help you to the best of their ability. Of course, I love my vet. It was a terrible experience last time. Look, putting your dog or cat into your car and driving to the emergency practice is a terrible experience. It's tough and it's frustrating. Then, of course, if I had a nickel for every time I heard, I don't want him to die in that cold, sterile environment. That's just a big deal. Obviously, lots of people say that, and you're right. That's why we do in-home care. So, just knowing that it's available, and some veterinarians can offer that themselves. They can go to the clinic. I mean, to your home from the clinic, but a lot of times they can't. So just be prepared for that. It is very expensive for a doctor to leave the walls of a practice. So most of them aren't able to do that. And there's some insurance regulation with traveling, with controlled substances that a lot of general practitioners are not set up to handle. So they don't not like you if they say no. It's just difficult for them to do that. So I'm going to bring this up because this is something that everybody brings up when we're talking about the end of life of their pet, and they say something like, "I just don't want him to suffer." And you're right, but there isn't. We don't have a good word for suffering, or we don't have a good definition rather for suffering. And suffering is going to be very dependent on the disease process that your pet has. So, for example, is a dog that has advanced arthritis suffering? Not necessarily suffering. They're very painful for sure, but there's different types of pain. There's pain like you just broke a leg, and then there's pain like you have the flu and you feel awful. And then there's pain from maybe this dog not being able to get up and move around and wanting to be with their owner, a little bit more like anxiety, right? So there's different types of pain. The point is that they shouldn't have to suffer at all. We want to do the very, very best we can to address that suffering so that our pets live the very best quality of life, and that we also provide them a wonderful, wonderful quality of death. So again, it's something to keep in mind. Remember that location. This is something that you guys have the ability to plan with your team, with your veterinary team. So whether or not it's as funny as, us coming to the home, but you take your dog into the car, there are some dogs that just love being in the cars. So here's a picture of one of our doctors literally helping a dog in the car. This was a cat that I had helped many years ago, and this family was Native American, and they had this kind of altar set up for her in a room, and it was a beautiful experience. So all of that, again, all of that is possible if you plan ahead. I'm going to give you a little bit of information now on the actual euthanasia process so that you know what to expect. Now, when with Lap of Love, and with most veterinary clinics, not all of them, but most veterinary clinics, we sedate beforehand. Now, I want to make sure you understand that this is not something that is medically essential to do. It is just simply what we feel is the best experience for both the pet and the family. There are some situations, and maybe some of you that have gone through euthanasia experience many, many years ago may not remember this, but it is becoming more and more over the past 10 years has become more commonplace, but 20 plus years ago, it was not, where we sedate the pet beforehand. And with Lap of Love, and again, many clinics, we do a sub-Q or IM sedation. So sub-Q means subcutaneous, or SQ means subcutaneous, and that means subcutaneous, meaning under the skin, okay? Or IM, which is intramuscular. So both of those, they look from the outside, they look kind of like a vaccine injection. They just kind of go under the skin, or we go a little bit deeper into the muscle. And both those injections, it is a slower absorption than when you give it straight into the vein. So the alternative to this, and this is what some clinics will do, is that they will take your pet and they'll place a catheter in one of the front legs, typically in this vein right up here in the front leg. And then they push a white substance. Many of them do this, a white substance, which is propofol. That's the Michael Jackson drug. And that propofol is also a human medication, obviously, that's used before anesthesia with humans. It takes the pet and also humans from consciousness to unconsciousness. So a lot of the times clinics will use that sedation protocol, but we don't. I don't like that rapid sedation look. It looks like a family member is just being kind of like, literally going unconscious in front of you. And that's not as pretty of a feeling as when they slowly go again unconscious, when they slowly become sedated. To me, that's a much more beautiful experience. So it's something you can ask your veterinarian to do. Say, I would really like a sub-Q or IM sedation, or I want the slow sedation. I don't want fast sedation where they go completely unconscious within a couple of seconds. Again, now I want to be very clear though, that you might remember euthanasia from many, many years ago, where they give the euthanasia solution directly in the vein. There is nothing medically or physiologically wrong with that. Euthanasia solution in and of itself, so euthanasia solution just by itself is an overdose of sedation, okay? So it is an overdose of sodium pentobarbital. And euthanasia solution does not stop the heart. Euthanasia solution sedates the brain, just like you're going under for anesthesia, okay? Remember, if any of you guys been under for anesthesia, and I have, they say count back to 100 and you're like 99, 98, and boom, you're out, right? It's this beautiful just fall asleep experience. It's not stressful, it's not painful, it's just that you literally just fall asleep. And that's what euthanasia does. It affects the brain first. The brain goes to sleep, and then the respiratory center is in the back of the brain. The respiratory center then, when it becomes an overdose, becomes shut off, and then the heart stops tertiary to that happening. So it's a very, very, very peaceful process. It takes around 30 to 60 seconds once you start giving that medication. If there's any type of cardiac output insufficiency, so basically that means cardiac, the heart, output not pushing blood insufficiently right throughout the body. So if the heart is not working, then it might take a little bit longer. I remember I had a family, this one boxer had boxer cardiomyopathy. So boxers get heart conditions very, very, very commonly. And this family's boxer had this condition, and it took about 2 minutes. And I was a new grad at that point, and I forgot to tell her that it might take a little bit longer. And she was so worried that maybe her dog didn't want to die at that point because it took a little bit longer. But it's very normal, and that's okay. And it just basically means that the heart is going to take a little bit longer to push that blood throughout the body. So again, it's a very it's just a different thing. Now there's a couple of side effects that I'll tell you that are, although not common, are normal to see. The two things that I tell everybody is that their pet's eyes won't close all the way, and their bladder might relax. Of course, if the pet has had any diarrhea or anything like that, then that might happen as well. And a lot of the times, the bladder or the diarrhea, relaxing might actually happen a couple minutes after the pet has passed, or it may not actually happen until you've moved your pet. So again, it's not something, I do not describe every horror that can possibly happen to people. I just don't think that that's necessarily something that, that I have to do by any means. I will tell you that we have done some internal studies just to see. And since I'm not sharing this with you in front of your own pet, this is not something that I typically say to people during a euthanasia experience. Here are the things that are most common. The most common thing that happens after euthanasia is this heavy breathing. And what that is that's when the brainstem gets shut off back here. Right before the brainstem gets shut off, the conscious breathing has stopped, and all of a sudden there's this very, very rhythmic brainstem breathing. And again, very, very, very normal, although not too common that we'll see that. Another thing that happens, and this happens more commonly in cats than it does in dogs, is what's called an agonal breath. An agonal breath, breath is a little bit of a misnomer because it's not an actual breath. It's just a spasm of the diaphragm. So just one deep breath, the jaw may or may not come down, but the lungs quickly expand and then contract. And it's just like a hiccup, which a hiccup is a spasm of the diaphragm. So it's just a quick spasm of the diaphragm and then it stops. Stretching is very, very again, it's rare that we see it, but the stretching happens. So the pets will stretch out their front legs, plus or minus their back legs, and plus or minus the neck getting stretched out. And that typically happens most commonly in a natural passing. So and a little bit more commonly in cats. So if the pet is very close to that natural dying process, I feel like I see that a little bit more. So basically, if this dog or cat is very close to dying on its own, I feel like I see it a little bit more. And the other is just some little muscle fasciculations you might see in the jaw up here or on the lip, or potentially a seizure, but it's extremely uncommon. And if we do see that, it's because the pet has already typically had a seizure condition already. So again, I'm not going to describe every single horror with families in the home, because they really do happen very, very rarely. And if they do happen, I will tell you that it happens more commonly in humans than it does in animals. Don't forget that we die also. We have to go through this process as well. Okay, so there are sometimes things go wrong, and we might actually use other places to give the injection for euthanasia. Crazy enough, I've had to use the tongue vein before on the bottom of the tongue. This poor little girl right here, and all these families have shared these photos with me. I was actually able to use this vein. You can kind of see here on her abdomen, because she was a 4-year collie mix and she had liver cancer. So you can see that it just really brought all that fluid into her abdomen. And so there are a lot of other options that we can use besides just the veins that we typically use. So if your doctor does have to use any of those things, don't feel like it's abnormal at all. After with us, with Lap of Love, after our pets have been deceased, then we give a paw print, and we have this nice booklet that we write the name and date of passing in, and little hair clippings. So that's just something we do. A lot of practices will do something like that. When within home care, we put the little dogs and kitties in these nice baskets. They ride in the front seat of the car with us, and then the larger dogs go on a stretcher that we cover with a blanket. And then there's home burials as well. So you, of course, more than welcome to bury your pet at home. Lime can be purchased at any tractor or feed supply store, and it aids in decomposition, and of course helps reduce odor as well. So it's just a really nice thing. Grief support is something that Lap of Love offers also. There are 3 types of grief support that we have. There's small groups that are free, Zoom support groups, so you can jump on it at any time. And then of course there's 6-week pet loss course and one-on-one coaching as well. So feel free to jump on our website if you or anyone else you needs anything like that. But with that being said, I know we're up at our time, so I want to thank you all very, very, very much. Please feel free to reach out to me, email me if you have any questions at all. But it's certainly, like I said before, it's an honor to help you, and it's an honor to be here, and it's an honor to help your pets as well.